Hello, everybody. Good afternoon. I'm Chaunda Cunningham. I'm one of the directors at Healthy Start in Pittsburgh. I am someone who is super excited to be the first one to kick off our series talking about infant mortality awareness. September, this is the month. This is the month that Healthy Start is spotlighting that it's part of the backbone of what we do here, really making sure that we are emphasizing the need to reduce infant mortality, as well as reducing maternal mortality for Black families in Allegheny County. So today, we have a beautiful special guest, Miss Brandy Gentry, that's here in regards to help us talk about this important topic. So Brandy, can you introduce yourself and share what sparked your interest in getting into this heartfelt work profession of birth work?
Yeah. So once again, my name is Brandy Gentry, and I'm actually a Pittsburgh native. I'm currently living in Erie. I'm continuing on the good work of reducing maternal and infant mortality rates. I initially began my journey as a doula because of my own experience with pregnancy and infant loss. So in 2010, on Christmas Day, my first pregnancy ended in a sudden stillbirth. My sweet son, Oliver Preston Rawls, was stillborn just after midnight. And throughout that process, like the actual labor and delivery process, my hospital stay, my medical care, I was able, even through my grief, to recognize that there were a lot of gaps in my care, and that there wasn't actually a person nor a position appointed to fulfill those gaps. And so after kind of completing a journey on my own of what I consider to be holistic healing, I really wanted the opportunity to go back and, I guess, essentially trade my ashes in for beauty and give back to people that were experiencing the same loss that I endured.
Brandy, thank you so much for sharing. It's such a powerful story, and it really has, just hearing it, so heartfelt, and the fact that you really turned that opportunity into a way of helping others, really being able to put your best foot forward and to showing that other women aren't alone, that unfortunately Black babies are dying 5 times more than white babies. It's just a fact. And it's so heartbreaking, the fact that there isn't the level of support that's needed. There isn't affordable, equitable care for Black families, not only just in Pittsburgh, but nationally. And so really bringing that to light and being that story, thank you so much for sharing that, because I know that's going to be really challenging and hard to do. But the fact that you've been really able to showcase how you can support others through your work as a doula, can you share with me some of the benefits that you've experienced being a birth worker, specifically being a doula, and how has being a bereavement doula or a doula in general really impact the families that have lost somebody?
Yeah. So I always tell the story that the kind of transition for me from exclusive bereavement care into what I've pegged as comprehensive doula support happened at a local hospital in Pittsburgh, where I witnessed a young famished mom in the lower level clinic needing someone to just come alongside her and help navigate a really complicated system. Her prescription for her 3-hour glucose test had been misplaced, and she hadn't eaten in 12 hours because she was fasting for that test. And she didn't have anyone to help her. She just wasn't sure of who to ask or what to do. She was very pregnant and very hungry. She traveled across the city to get there in hopes that, she'd receive her bus tickets that are promised after every appointment. And she was just needing some help. And I was actually there with one of my clients who was anticipating the loss of her baby due to a genetic issue. And I actually stepped aside from that case to go work with who essentially was a stranger, the mom that I shared. And I was able to help her get a new prescription for the glucose test and guarantee that she would have her bus tickets to get home. And it was kind of in that moment that I always say that what happened was I learned that there was a lot more to be lost in birth than just the baby. And that was a revolutionary moment for me in my career, because what I started realizing is that we need comprehensive doula support. We need people that are going to position themselves as birth workers, regardless of the outcome. We need to know that sometimes babies die. Many times, specifically in the Black community, said deaths are often preventable. They are preventable. And when they are preventable, I want to position myself along with those that I train or those that I collaborate with. I really want us all to position ourselves to be acts of preventative care. Like, I want to bring that phrase to life. I want to be an advocate. I want to be an educator. I want to be a supporter, to provide the physical, emotional, and educational support to save moms and babies from enduring unnecessary birth trauma that ultimately sometimes results in loss. On the flip side, there's also times when death is imminent, when families are receiving life-limiting diagnoses, such as anencephaly. That's something that I had no idea existed until my first time walking with a young Black mom from McKees Rocks who, had received that diagnosis in her pregnancy, and she was just a teenager, navigating the traditional complications that come with pregnancy, but now this very complicated diagnosis that's considered fatal by definition. But she was wanting the opportunity to meet her baby alive. And while that wasn't guaranteed, the point was she needed to stay pregnant in order for that to even be a possibility. And so many care providers may deem it futile for someone who's in that situation to take on another support person, such as a doula, because, well, what's a doula going to do? Your baby's going to die. Not so. What we do as bereavement doulas is we focus on helping families to prepare for the hello, in addition to the goodbye. We want families to know that a birth is still a birth, regardless of the expected outcome or the unknown outcome. We want families to know that, you can look upon a baby born sleeping and still find them beautiful, that we still find them beautiful, that we can still take pictures and we can still do footprints and we can still swaddle their babies and help them make memories with siblings and other loved ones. And for those reasons, I feel that bereavement doula care is incredibly impactful. I think that the art of advocacy that comes with that level of doula care is incredibly impactful. I think that it changes the trajectory of a family's ability to heal. I also think that we combat unnecessary trauma, because where there is grief, there does not have to be additional birth trauma. You can grieve the loss of your baby without having to feel traumatized by what you may endure while being in a system that lends itself to delivering live births. Right. And that's what I feel my story was representative of, was a lot of unnecessary trauma. There's many details that I'd love to share at another time about my story, but I really think that that's the driving force behind my doula work as a whole, but more specifically, why I work so hard to rally around bereaved families and to really promote bereavement doula care as a necessity. I think we should be offering it to families, to our Black families, helping families funeralize their babies, memorialize their babies. That is a part of our community narrative. Our heritage tells us that when we lose people in our families, in our tribes, what do? We don't just send them off in the wind. No, we have rich roots in ways that we memorialize and show final acts of love to our families members when they pass on. And I remember when my son died and they came and asked if I wanted to have a funeral. And I remember thinking, wow, I didn't ever anticipate having to do this so early, but secondarily, of course, because I know nothing different. When someone in my family dies, we have a funeral. They have a casket, we bury them, we share a meal. It was very standard. And I think that we need to normalize that for families who are experiencing the loss of their babies, and having a well-versed and experienced bereavement doula standing by their side to help facilitate these things so that they're not having to navigate these unexpected systems alone. I think that's super important.
Gave me chills. You definitely have. I mean, the fact that you shared so many nuggets of information, that was so important, Brandy. I think part of what I want to take away from that is, again, a birth is still a birth. And I love how that family still deserves to have exactly what they need, and they deserve to be able to see that beautiful baby, as you said, mentioning baby's just asleep, or if that's the imagery or the narrative that we can share, that's so powerful. Also, I'm hearing there's a need for education and advocacy. The healthcare system needs to be able to recognize that every single person deserves to have this sort of support, not just because someone has or someone can afford it, or because someone can pick someone fancy out of a catalog. Everyone deserves to have a doula, point blank, period. And what I'm also hearing is that we need to make sure that the doulas that we do have the additional education and training to be able to manage this, because we can take this home. As you mentioned, if we're Black birth workers working with other Black women, that can be a lot of trauma that we're carrying with them. And so we need to make sure that we're educating these doulas and these professionals who are in this space, so then they are also there to put their stuff to the side, to be able to focus on the family, and be able to walk with them and not look at it as I'm carrying someone. Because again, having a family be able to go through this whole entire process and still be able to say that I had a beautiful birth is powerful. So thank you. I really appreciate that. You really did already answer my last question, but where can families look for this sort of level of support? So I'm hearing you say they, if they're experiencing a traumatic birth, or if they're having just different challenges, what else would you where else would you share as far as the resources for families to acknowledge?
So once again, I think to kind of tie this into the comprehensive model, I really and truly am moving towards the school of thought that all doulas should be trained and consider themselves competent birth and bereavement doulas. I think that we're doing our Black community members a great disservice by letting this remain a niche, if you will. I feel that life and death often meet at the veil that is birth. It's very, very common knowledge now that the morbidity rates are leading to higher mortality rates in our community. The mortality rates of Black mothers then are linked directly to the mortality rates of our infants. Corrupted systems and processes, the ability to hear and react or to be proactive at best has really been depleted over the last several years when caring for our Black and Brown families. And so I feel that we should be equipped to serve. We know these statistics. We're really good at quoting them, reciting them, using them to get lots of funding for our different programs, but I don't think that's enough. I really would charge all of us to consider that if you're a doula, perhaps you are also equipped to be a bereavement doula, because at any given moment, one of your families who were expecting a live birth, could go into the hospital at 39 weeks and hear the phrase, "I'm sorry, there is no heartbeat." And for this reason, in the model of my practice, in the way that I've been able to, as you said at the beginning of our time together, that I'm well known for my work. Well, I'm well known for my work because I have a mission of collaboration. I am a collaborative being. I believe that each of us as community workers, as community members, liaisons, bridges, if you will, we have to work together and we have to stay connected, because one of us alone, one organization, one individual, we alone cannot carry the weight of these statistics. We cannot carry the weight of these poor birth outcomes. We can't stay siloed in Pittsburgh. We can't stay siloed in Erie. We can't think that it's just about the food deserts, or that it's just about the postpartum depression, or that it's just about having a birth doula, but not a bereavement doula. No, we have to recognize that this is a collective fight. And how do we best fight our battles except that we come together and we collaborate and we refer? And so one of the main focuses of the organization that I'm, currently working as the director of postpartum care, Birth Root Community Doula Alliance here in Erie, we have a mission to provide our families with community-based resources that will enhance their care. We remain companions. We are consistent, we are stable, we advocate for them continually, but what advocacy should really result in is change. And how do we get change except that we do warm handoffs, that we do personal introductions, that we lead them into the offices of, behavioral and mental health services that are going to help them work through deeper rooted issues that may actually be compounded in their trauma and how they're responding to said birth trauma. And so staying connected as a provider with my community partners and allies is, I feel, necessary. I think that continued education and connection in this way is essentially going to help improve birth outcomes, even for families experiencing pregnancy and infant loss. I think that it's important that our patients, clients, consumers understand that you don't have to receive services solely from one person or entity, that it's okay that you can have a doula who comes and provides postpartum doula care in your home. And while that postpartum doula holds your baby, you go upstairs and you get some virtual postpartum depression services from a clinical provider. I think it's okay that if you lose a baby, and all you really want to do is participate in memorial activities with a local support group, I think that's great. But you should probably still be willing to maybe work with a social worker in your local doctor's office who's able to keep you connected with other supportive services in the community, so that at any given moment when your needs may shift or change, and now you understand that, actually part of why you lost your baby is because perhaps you were having issues with access to transportation, right? Like, I think that encouraging our families that while we can remain a source of support and stability for them, that we are not the end all be all, because that is an act of disservice also. So,
Brandy, thank you. Yes, 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 and yes. The work that you're doing, as well as the work that we're doing here at Healthy Start, again, we can't do it alone. We aren't going to be able, we can't save everybody. And it's really being able to have everybody walk along each other, and really being able to understand that community-based doulas and other folks such as social workers and community health workers and therapists, we all have to work collectively, because we are the ones that are creating that bridge to bring trust back to the healthcare system. So thank you so much, Brandy. This was such an amazing time that we were able to chat together. I really just wanted to thank you. Again, I'm excited that you'll be in Pittsburgh soon, so we'll be able to touch base and see each other again. But again, thank you everybody for being present with us and enjoying this amazing chat with us. Just want to let you know that this was the first of our series that we're having. And please be on the lookout. We have so many things happening. Our CEO, Jada Sherrill, is going to be interviewing Janaya from Maddie's Gems. We're going to have Candace Mason from the Allegheny County Health Department. She'll be being interviewed during our Milk Minute series, as well as we're going to have encouraging words from one of our amazing birth workers and also parental interviewers in Ghazi Tibbs. So please be on the lookout. We have amazing things in store. Again, let's uplift and make it aware that Infant Mortality Awareness Month is a huge month, not only for others to grieve and loss, but to celebrate that we have the opportunity to make change, but we have to do it together. So everyone have a good rest of your evening, and thank you for being with us.